Ethiopia is moving closer to peace talks in its northern Tigray region. On Friday, officials in Tigray laid out conditions for negotiations, including unrestricted access for humanitarian aid. The conflict began last November when Ethiopian Prime Minister Abiy Ahmed ordered an airstrike in the region. He accused Tigray forces of attacking a government military base. Since then, hundreds of thousands of people fled the region as fighting ramped up. The UN pushed the prime minister to initiate peace talks, but he refused. He declared victory in December, but fighting continued in the region. Thousands of people have reportedly died in the conflict. Millions more face widespread food, water, and medicine shortages. Joining us now is Francesco Rocca. He is the president of the International Federation of Red Cross and Red Crescent Societies. Francesco, thank you for being here and for the work that you do. So what is the latest on the humanitarian crisis in Tigray? Can you put it into perspective for us how bad the situation is in the hardest hit areas?
It's one of the best I ever seen in my role, in my capacity as a president of the International Federation, and I visited several countries, I can assure you. I'm still, after 1 week, overwhelmed by the level of emotion and the impact that this visit had on me. The huge need and are enormous, and the needs are enormous, and still people and millions are paying the consequences of the conflict. Unfortunately, the hospitals and the medical facilities of the Tigray Health Bureau are 95% of them are not working. They are out of medicines and drugs. They cannot treat anyone. I visited 2 hospitals. Both they were closed because the lack of medicine. So they have no way to treat the inpatient. They are working only for as outpatient services, but even as outpatient services, we can call us for the psychological support because they cannot provide any kind of medical drugs or medical support. So this is something that I've never seen in my life. And then another thing that struck me was the systematic aggression to the health facilities. We have several reports of looting in the rural areas, in the villages, all the medical facilities and the health posts, and because many of the people in Tigray live in the rural areas, they do not live in the big cities, but probably part of them live in Mekelle, Adigrat, Aksum. So this is it's really a serious situation. And then also the number of
given your position, it's remarkable, given your position that you oversee disaster relief all across the globe, for this to be, as you said, overwhelming and one of the worst situations you've seen. It makes me want to ask the challenges that aid workers and folks in your organization are facing.
Look, it is very difficult because you have to understand that we are still working on the ground. So the situation on the ground is very volatile. And I have to be very careful in expressing about how difficult it is the situation. What can I assure you is that the Ethiopian Red Cross volunteer plus our people is paying really a bloody price to this conflict. And they are trying to reach also the rural areas, but most of them, unfortunately, because the conflict, because they are still fighting, there is no ceasefire in the rural areas. So are very, very difficult to be accessible for the humanitarian workers. Plus, and this is still ongoing, the airport is closed. We have no clearances for our humanitarian flight. So we cannot import medicines and drugs. We are ready. We have our flights ready. We have loaded our cargoes, but we cannot send medicines, drugs, and food because we have to remember that several, especially the elderly and the children, are in desperate need of food in rural areas on the IDPs camp. So maybe I would say that also the psychosocial support for the aid workers for the very high level of frustration on working in such a very difficult condition about access, or when there is access, there is no opportunity to provide a real care because you have nothing to distribute.
I can hear the frustration that you're expressing. I want to ask if the Ethiopian government has been allowing aid to be delivered. They claim that they are, but there are also reports of military forces targeting food warehouses. What is the reality?
Or maybe they have different channels, an invisible channel to provide aid, because so it's a different channel that we are using. So this is. I don't want to blame anyone, but as a reality, unfortunately, hospitals are empty. They cannot distribute, as I said, and I want to repeat, no medicine and no drugs in the hospitals, and no food also for the inpatients. So this is the reality. The IDPs camp are supported by the local communities. So people of Tigray, the people living in Mekelle, where unfortunately now are living more or less 200,000 IDPs, are supported by the same people of living in Mekelle. So this is the sad reality. Plus, and also, sorry, I forget before, another things that I forgot, the reunification of family. Because of the fight, many people were separated. Some are stranded in Sudan, some in other parts of the region, some in Mekelle, and there are children living alone in the camps. So our teams are also working around the clock in trying to reunify families when this is possible.
That the fleeing that we've heard from so many thousands of people who have fled, and so many millions, as you say, who remain there in need of medicine and food and water and simply don't have access to it. One last question before you leave us. How has the coronavirus impacted your efforts in Tigray?
I want to be very honest. Because I've been, for some picture that I took when I was there visiting IDPs camp, and think about people living in the classroom because they are allocated in schools, and I was blamed also by my media people, the people. So they said, "Oh, you were too close of the people." I think that unfortunately, coronavirus is the last problem that these people they are struggling for living day by day. So this is the issue. So if it was enough, the drought, if it was enough, the desert locust, if it was enough, the COVID-19, then now the conflict. But unfortunately, I think that the level of despair of the IDPs and the people stranded is putting them in a situation, of course, of risking to be infected by coronavirus. But this is their last concern. They have to find food. They have to yeah.
Yes, I understand when you're starving or you don't have access to water at all, things like coronavirus, worrying about that almost seems like a luxury.
Yeah, exactly. Sorry if I interrupt you, but because it sounded, this is something that really, in every part of the world, of course, I'm putting very high in the agenda, the coronavirus. I'm talking about protecting life. I'm talking about DPI and whatever, right. The social distancing. And then there, everything sounded so ridiculous about people living in such difficult condition and not having access of the basic health services. This is the paradox of perspective of the place of the world in which you are forced to live.
The crisis there so horrific, and it's really received so little attention as we've been absorbed with all of our own crises that in some ways.
And I sincerely thank you. And I sincerely thank you for covering and giving the voice to the vulnerables. Thank you so much.
Thank you. Francesco Rocca, thank you.